back as we head into a festive time of year filled with family gatherings, holiday celebrations, and other events. Respiratory viruses can surge. A runny nose or an unrelenting cough could be more than just another common cold.
Yeah, it might be an infection caused by the flu or COVID-19 viruses. Joining us to talk about how to protect yourself, Dr. Jason Bowling, an infectious disease specialist at UT Health San Antonio. Good morning. Thank you so much.
Good morning.
So as we enter the upcoming holiday season, what do people need to know about flu and COVID, which, by the way, in the Houston area, those are not very high right now?
The numbers are low right now, but we anticipate them to go up. I think it's important for people to be informed so they can take the appropriate precautions. They're still out there. Over the last 3 months alone, over 600 people died from COVID-19. So it's important for people to take steps to protect themselves.
To still take it seriously.
Yeah, absolutely. Doctor, I know we have this conversation yearly, right, on what to do to protect ourselves. Just run through common reminders on what we can do to keep safe against these respiratory viruses.
Sure. There are plenty of steps that people can take to protect themselves. Each step they take adds additional protection. The most important step is to get up to date with the vaccine, both the COVID vaccine, the flu vaccine. You can get those at the same time. Those still provide the best protection from severe illness, ending up in the urgent care or ER instead of at time at home with your family. People should do lots of hand hygiene, either using soap and water or an alcohol-based hand sanitizer. And then people that are at high risk for severe illness should consider wearing a well-fitted mask if they're going to a crowded public setting, particularly if that's indoors.
Yeah. So let's talk about vaccines, because obviously I know that doctors always recommend vaccines for both flu and COVID. But then early on during the pandemic, there was a lot of confusion about like, oh, you need a vaccine at this time and this many months apart and 2 doses and blah, blah, blah. So now people are confused on like, well, I already got it, so do I need it again? Run through who is eligible and whether or not it's now just an annual shot.
That's a great point. Yeah, lots of people it was very confusing. People were fatigued. Unfortunately, it is much, much simpler now. Everybody that is 6 months of age and older, that's most people, just needs to get 1 dose of the COVID-19 and flu vaccine.
Yeah, people worry too about side effects from the vaccine. What do the side effects continue to be? Are there any new side effects, anything that people should know about or be worried about?
This is a great question, and people should get their questions answered. Vaccines are actually better studied than a lot of the over-the-counter medicines people take every day. There are no new symptoms or side effects from the vaccine. The symptoms the side effects when people do have them are very mild. Most common, it's some soreness, some swelling at the site of injection. Some people have some mild fever, low-grade body aches that last for about a day, sometimes less time than that, but it goes away. And that's a small price to pay for the risk of getting severe illness and, again, having to see a doctor, spend time in the ER, or worst case scenario, end up admitted to the hospital or ICU.
Yeah, and especially this time of year, it's more on people's mind because they don't want to miss a holiday celebration. They don't want to miss travel plans and things like that.
That's right. You want to spend your time with your family and friends, and you also want to protect your family members. Everybody's going to have some family members at those gatherings that are at higher risk for complications or getting sicker. And so it's really important we take those steps, even if you're not at high risk yourself. Getting that vaccine can help and protect your family members, your friends.
Dr. Bowling, I have one more question for you. I know oftentimes we talk about getting the flu shot once a year. I know they rolled out a new COVID vaccine, maybe September, October of this year. How often, what's the recommendation on how often we should get the COVID-19 vaccine?
So that's a good question. Most people 6 months of age and older just need the one dose of the COVID vaccine. People that are at higher risk, so those are your adults that are age 65 and older, or people that have conditions that suppress their immune system, it's recommended they get a second dose 6 months after their first dose, just to increase that protection a little bit further.
Okay. Yeah. Do you expect that after the holidays we will start to see a surge of flu and COVID again?
Yes, absolutely. We should start to see an increase, unfortunately, after Thanksgiving. And it increases probably in December, probably starting to see really high activity in January.
All right. Dr. Jason Bowling.